infertility is a deeply personal and often painful journey that affects millions of individuals and couples, something I know all too well. Infertility Awareness Week, recognized each year in April, aims to break the stigma and spark important conversation around reproductive health and emotional well-being, and of course, access to care. Joining us now to talk about this is Dr. Lindsay Fish from Denver Health to help make some sense of infertility struggles. It's a really difficult journey when you're on it, and not a lot of people like to talk about it for various reasons, but we want to talk about this today. So how common is infertility in the United States? And I know this is a tricky, not great question, but what causes it?
Yeah, so first of all, infertility is defined for most women as an inability to get pregnant after trying for 12 months with regular unprotected sex. It affects a lot more people than we talk about. 1 out of 5 women in childbearing age. So what causes it? Unfortunately, a lot of the time we don't know, which makes it so hard. But there are things we do know. For men, you could have issues with your sperm, or women, issues with your ovulation. And affecting both men and women, age or chronic medical conditions can contribute.
Yes, I think that's something that not a lot of people talk about. Is a lot of the times it can be the man. It's not necessarily the woman and what's going on in their bodies.
Right, and that is the other piece of it that's so important, is the emotional and psychological impacts on people, which is, grief, depression, anxiety, things like that. But it also affects the man too. But women often feel so much additional guilt and shame about an inability to sort of have a child. And for people who are of different cultures who can't speak about this, and even in our culture, women don't really want to talk about it. And imagine 1 out of every 5 women. I mean, there's a lot of women experiencing this.
Yes, when I was going through my struggle, I had IVF for both of my babies. People, when you would say something, you'd be embarrassed, and then they'd be like, oh, me too. It was more common than you think to talk about it. So it is good that we're starting to, as a culture, talk about things more, and then you have someone to bond with over some of these things that you're going through. So are there specific populations who face greater barriers to infertility care or have higher risks for it?
Absolutely. So we see greater challenges for our communities of color, our LGBTQIA plus communities, our communities with lower income, that impacts, for example, people who don't have the same insurance status or insurance coverage. If you don't have coverage, infertility treatment is tens of thousands of dollars each round.
It is wildly expensive. So it makes people not be able to do it because it is definitely a money issue.
Absolutely.
Yes. So what advice do you have for someone who may be struggling with infertility? It's a very personal journey, and it's really hard. And I think one of the things too is that it takes so long, because it's your cycle and you have to go through this, and it's not just like, oh, quick fix and a surgery. It takes months, years. It's a whole process.
It really is. I mean, I think the first thing, which we already said, is you're not alone. Millions of people have this. So remember that and seek support. Recognize that there are emotional support things out there, therapy, support groups, communities that are working on this together. And if you're struggling with it, talk to your doctor. The sooner you can get in with a doctor, have a conversation, learn what the tests are, the treatments are, the more likely we are to do it. And lastly, there are lots of ways to create a family. And it's important to know that if you want to create one, there are lots of ways to do that.
Yes, there are, and it's not necessarily always your biological. I have friends who have adopted kids and joined and fostered and done wonderful things as well. So again, there are many ways to have a family. So Dr. Fish, thank you so much, and thank you, of course, always for your time. This is something we definitely want to keep talking about. So for more information about Infertility Awareness Week, head to our website at cbscolorado.com.